Hey, it's John over here at Contract Diagnostics, and we're reviewing articles again. And this one is on a prediction on what's going to happen in healthcare for the year 2024. So as we wrap up a very interesting 2023, I wanted to spend some time reviewing this article. I think some of the ideas are on point, and I think they've missed quite a few of them. So the year of AI regulation is the first thing that's going to go on. So we have talked to many employers out there, and as artificial intelligence grows in awareness and the way that some people use it and the technology that is likely to change the world, we see a lot of hospitals, a lot of employers struggling with coming up with policies around artificial intelligence. What can their employees use them for? Whether you're in the C-suite creating marketing plans, or in the marketing department creating sales plans, or in the sales department executing sales plan, or whether you're a physician trying to find ways to be more efficient with the administrative burden that the hospital has placed on you. Can you use it for patient care decisions if you don't know what to do, or if you've got a couple different options and you're unsure which might have better data behind it? Can you feed a bunch of clinical studies into it and tell it to summarize it for you and use that in your clinical decisions? If you're a researcher, can you use it to research articles and papers? What can you use it for? So as hospitals struggle to come up with policies around this is one of those things where you'll see a lot more regulation. You'll probably see some guidelines and some policy updates from your employer if you're currently attending. And if you're in training, you'll likely see it as well as far as what you can do from your role. You'll likely have meetings on how it's appropriate or inappropriate. The hospital system may lay over some artificial intelligence. In fact, that's one of the next things that they bring up here is how they incorporate artificial intelligence as a revolution into healthcare. So as we look at how they start to use healthcare, we're going to see a lot of applications this year. We've seen a lot of, ChatGPT just came out barely over a year ago, and we've seen the market dramatically shift and change since then. You'll see medical tools laid over. We've seen how these things can pass medical exams. So we know they can be uploaded with a lot of data, but whether they start to have their own kind of thoughts and creativity and stop hallucinating is a whole another prospect. But as they build these programs out to be better, we feel that there's going to be many applications used, and I think you'll see some on the forefront trying them out, and you'll see some sitting back and waiting to see what happens. And whether your employers, the former or the latter, I think is something that I would love for you to keep us posted on. But as everyone starts to experiment with artificial intelligence, both at home for how they cook a certain meal to how you take a trip with your kids or do travel research, people are going to start using it for their jobs. And whether you're in any role in a hospital, let alone a physician, there's going to be a lot of applications and a lot of tools. Healthcare specifically, because it's such a big portion of the economy in the U.S., you're going to see a lot of options for tools and a lot of ways that people could adopt it. Now, whether that's on an individual physician basis and in a private practice setting, or whether that's a corporate basis in a large for-profit or nonprofit hospital, single hospital, or a system in general. So keep an eye out for what comes with artificial intelligence in 2024, because I think it's going to be fantastic, and I really anticipate a lot of time saving by physicians with the appropriate employer interaction as far as how they incorporate these tools on how it's going to save them from the administrative burden. We've talked earlier about an article that I read, which we can link here, that talks about hospital margins surging in 2024. And this may come from physicians being able to see more patients because of efficiencies in medicine, like artificial intelligence and the utilization of certain applications. So I think 2024 is going to be a lot of interesting stuff as far as AI. You'll also see different levels of patient engagement, says this article. It talks about, they'll be able to meet the needs of the patients better in a post-pandemic world as far as scheduling, as far as seeing patients, and as far as what percent of patients have availability to which appointments. So I think booking is going to be easier with technology. You're going to see a lot of impact in how patient engagement is handled, both pre-visit, during the visit, and post-visit. So says this article for 2024. Now, we think it missed a lot because we think it didn't say anything about the physician shortage. It didn't say anything about the future compensation of hospitals that we've read in other articles. And I think both of those things bode well for physicians and their continued negotiation or renegotiation, as it may be, with an employer as they look at taking a job sometime in 2024 or in 2025, or even re-signing a contract in 24 that you've been part of for many, many years. So as we see the pendulum shift from a pandemic to a post-pandemic to a totally different world in 2024, I think there's going to be a lot of negotiating capacity in the physician's hands. So when you come up on that note, please give us a call at Contract Diagnostics. We're here to help with anything compensation, contract, negotiations, tips and pointers. It's what we do every day. We have a fantastic team here. You can see everybody on the website. We don't outsource your information and your work to anybody. We do all of it here in-house, and we're super proud of the work that we do. So if we can help answer any questions on anything, we have a free 15-minute inquiry on our website. Take advantage of it. You can contact us through the website, or you can just give us a call. Everything is online, and we are here almost 24 hours to help out. So again, I'm John, and feel free to reach out anytime.